To wind down, it's very important to make that moment for a skin check, and especially after a few months of being directly in the sun. And joining us this morning with advice for fall skincare is our good friend, Dr. Alyssa Finley with Finley Dermatology. Good morning.
Good morning.
Now, a few weeks ago, I had to do a skin check on myself, and I have to say, you know, you were stressing the importance of really making sure that everybody takes the time to do that, especially after being in the sun over the summer.
Yeah, we see a lot of sun in the summer, but also in the winter months. It's important to just be aware of changes in our skin and constantly observing ourselves and our loved ones for changes.
Absolutely. And you know, so you are a Mohs surgeon and a cutaneous oncologist specializing in skin cancer treatment.
Yeah.
So tell me this, what do you consider one of the most crucial aspects of your role?
I think about this a lot. You know, when you get a diagnosis like skin cancer, it's completely rattling. I mean, it's an emotional time. And, you know, I have patients that I've been seeing for 10 years and they've had multiple, but maybe they have one in a different spot. And so they're nervous about what that's going to look like.
Gotcha.
We have people that obviously have never been diagnosed before and they don't have family or friends that have gone through a similar experience. So I think to guide people through that part of their life is really an honor, and you want to do so in a way where you're educating people and, you know, just importantly guiding them with, you know, evidence-based care.
Absolutely, and I've gotten to know you obviously throughout the last few years. You have such compassion about you too, so I would think that really does help too when you're working with your patients.
It does. I mean, you know, it was welcome to my 40s and I dealt with my first thing on my skin, you know, so I really have been there. And I think that it is just such a tough time for many people. So if we can, you know, guide people through that and help them cope with it and just give them the best treatment and best results, then we're doing our job well.
You're doing your job.
Yeah.
And let's talk about this. So can you use radiation as a form for skin cancer to treat it?
Well, I'm just excited to be on here talking about this because I've thought a lot about this, and this is something that has been coming to the forefront in my practice and in my office so much more recently.
Right.
You know, I think the population that's coming in with skin cancer is younger and younger, which is a scary thing that we're seeing, but I think we need to address it. And then, you know, on top of that, though, people are coming in being provided information that, you know, you're young, you don't want to have a surgery and a scar, and this is easy. And that's really potentially dangerous information. You know, we really have to talk about what is the most appropriate and best treatment for each situation. Certainly not all skin cancers require Mohs surgery, but Mohs surgery is certainly the best option for many situations.
It is the best option for many situations.
For many,
absolutely.
Yeah.
And let's talk about the patient experience with Mohs surgery compared to truly that radiation piece of it.
Right.
Is the surgery, like, would you opt for the surgery over the radiation?
Well, again, there's lots of unique factors that go into it. You know, one of the things that I'm able to do for patients that are good candidates for Mohs surgery and that I treat is I can treat in one setting where they go home and they know that skin cancer is out completely. The risk of recurrence is super, super low as possible, which I think just gives people that peace of mind.
Absolutely.
And then the second part is the putting people back together, so the reconstruction or the stitching. Sometimes we don't stitch, but I always tell my patients, I'm going to be with you every step of the way. We're going to guide you through this, and so that's where you want to find somebody where they have the experience and the ability to provide those reliable, good results.
Absolutely.
You know, radiation is tricky. Certainly there are unique situations where radiation, you know, I will send my patients to my colleagues in radiation, and there are unique circumstances that warrant that. There are certainly non-surgical candidates where that may be a good option. But I think there's a lot of misinformation floating out there. It's not like you just do radiation and you're done. It can oftentimes require many, many visits. For some people, that's very tough. Most importantly, the cure rate is generally not comparable. And radiating the skin can pose a risk for increased skin cancers in the future. Wow. So there's a lot going on there that I think we're not talking about. It also changes the skin. So you can get, you know, a more like an altered texture, more taut, firm skin, color changes. So if somebody does recur with that skin cancer later on, it's a much more difficult situation.
So there is a lot to unpack here.
There's a lot going on that I think we have to be more vocal about.
Well, thank you so much for starting the conversation.
Thank you.
Always love having you here.
Love being here.
Always full of such great advice and information.
Love being here. Thank you.
And we're going to provide more information and insights from Dr. Finley right over at our own website, rhodeshow.com.